Getting sick in America is often not just a medical event, it's a financial one. Many Americans have grown accustomed to the anxiety that comes with opening a medical bill after a hospital visit, or even a simple doctor's appointment. The country's healthcare system, while technologically advanced and capable of delivering extraordinary treatment, is also one of the most expensive in the world. Each year, the United States spends trillions of dollars on healthcare, more than any other nation on Earth, both in total and per person. Yet, despite this enormous spending, millions of Americans still struggle to afford care, skip necessary treatments because of cost, or find themselves saddled with medical debt. To understand why getting sick is so costly in America, it helps to begin with the sheer scale of the system. By 2023, national health expenditures reached almost $5 trillion, amounting to roughly $14,500 for every person in the country. Health spending makes up nearly 1/5 of the entire U.S. economy, and it continues to grow faster than wages and inflation. For comparison, countries like the United Kingdom, Germany, or Canada spend less than half that per person, yet tend to achieve similar or even better overall health outcomes. This mismatch between cost and result is not a secret. It has been documented for decades. But the reasons behind it are tangled in a web of policy, business, culture, and history. One of the simplest explanations, though not the easiest to solve, is that Americans pay more for almost everything related to healthcare. From hospital stays to MRI scans, from prescription drugs to medical devices, the prices charged in the United States are substantially higher than those in other advanced nations. In many countries, the government negotiates prices with hospitals, doctors, and pharmaceutical companies on behalf of citizens, using its buying power to keep costs in check. In the U.S., prices are set through a fragmented network of private negotiations between insurers, providers, and manufacturers. Each hospital and insurance company cuts its own deals, often in secrecy, leading to vast price variation even within the same city. The result is that the same service, a hip replacement, an emergency room visit, a blood test, might cost 3 or 4 times as much in one place as another, and often far more than in any other country. Another piece of the puzzle is the administrative complexity of the American system. Because there are so many payers, private insurers, government programs like Medicare and Medicaid, employer plans, and supplemental coverages, the bureaucracy needed to handle billing, claims, and paperwork is immense. Doctors and hospitals employ entire departments devoted to coding and billing. Patients often receive multiple bills from different providers for a single episode of care. Studies have shown that administrative costs account for a far larger share of total health spending in the U.S. than elsewhere. Every layer of complexity adds cost, yet none of it directly contributes to making people healthier. Insurance design also plays a central role in why getting sick is so expensive. Many Americans think that having health insurance will shield them from large financial burdens, but the reality can be different. Modern insurance plans, especially those offered through employers or purchased on the individual market, often include high deductibles, thousands of dollars that must be paid out of pocket before insurance even begins to contribute. Copays, co-insurance, and out-of-pocket maximums pile on top of that. For a healthy person, this might not seem like a problem. For someone who suddenly becomes ill or needs surgery, it can quickly become financially overwhelming. Even a short hospital stay can generate bills that far exceed the average family's savings. And then, there are the uninsured and underinsured. Although the Affordable Care Act expanded coverage dramatically since 2010, millions of Americans still fall through the cracks. Some live in states that did not expand Medicaid. Some earn just enough to disqualify for subsidies, and others simply cannot afford the premiums. For these individuals, getting sick can mean choosing between paying for care or other basic needs. Even those with insurance can be considered underinsured, covered on paper but exposed to massive costs when something serious happens. Beyond the insurance structure, the way the healthcare system pays for care also drives up expenses. In the United States, most care is paid for through a fee-for-service model, where providers are reimbursed for each visit, test, or procedure. While this system ensures that doctors and hospitals are compensated for their work, it can also create incentives to provide more services, not necessarily better or more efficient ones. Preventive care and time-intensive counseling, which can prevent disease or manage chronic conditions, are often undervalued compared to procedures or tests. The result is a system that rewards volume and complexity rather than outcomes and prevention. The burden of chronic disease adds another heavy layer. America faces some of the highest rates of chronic illnesses, obesity, diabetes, heart disease, among developed nations. These conditions are expensive to manage, requiring ongoing medication, frequent visits, and often hospitalizations. An aging population compounds the problem. As people live longer, they accumulate more chronic conditions and require more medical care. Adults over 55, while a smaller portion of the population, account for the majority of health spending. In essence, the system is treating more illness for longer periods, at higher prices, with costlier technology. Technology itself is a double-edged sword in this story. America's hospitals and research centers are among the most advanced in the world. They develop new drugs, devices, and surgical techniques that save lives and improve quality of life. But innovation often comes at a steep price. New cancer therapies, gene treatments, or specialty medications can cost hundreds of thousands or even millions of dollars per patient. For those who need them, these advances can be miraculous. For the system as a whole, they push spending even higher. Market dynamics further distort the picture. Over the past 2 decades, hospitals and physician groups have consolidated, merging into large regional systems that dominate local markets. With fewer competitors, these large systems can negotiate higher reimbursement rates from insurers. Insurers, in turn, pass those costs along to employers and consumers through higher premiums. The same trend occurs in the insurance industry itself, where a handful of large insurers control much of the market, giving them leverage but also limiting true competition. Inflation in the broader economy and shortages in healthcare labor have intensified these pressures in recent years. Nurses, physicians, and other health professionals are in short supply, especially after the strains of the COVID-19 pandemic. To retain staff, hospitals have raised wages, and those higher labor costs are reflected in patient bills. The price of medical supplies, equipment, and pharmaceuticals has also climbed. As inflation touched nearly every sector of the economy, healthcare was no exception. What all this means for ordinary Americans is sobering. Premiums have risen faster than wages for years, eating into take-home pay. Employers, facing their own cost increases, often shift more of the burden to workers through higher deductibles or reduced coverage. For individuals buying their own insurance, premiums on the Affordable Care Act marketplace are expected to continue rising in coming years, particularly as temporary federal subsidies phase out. Even those with stable coverage find that surprise bills, uncovered services, or out-of-network charges can strike unexpectedly. For many, the financial consequences of illness extend far beyond a single episode of care. Medical debt remains one of the most common forms of personal debt in the United States. Families drain savings, take on credit card debt, or postpone other life plans to pay medical bills. The stress of financial hardship adds to the physical and emotional toll of illness itself. Surveys repeatedly show that Americans rank healthcare costs among their greatest concerns, alongside housing and retirement security. The broader impact on society is just as serious. High health spending diverts resources from other public priorities, such as education, infrastructure, or social services. Employers that spend more on health benefits have less flexibility to raise wages or invest in growth. Small businesses often struggle to offer coverage at all. For government programs like Medicare and Medicaid, rising costs translate directly into pressure on federal and state budgets. And despite this enormous expenditure, the U.S. still lags in key health outcomes: life expectancy, infant mortality, and rates of preventable deaths are all worse than in many other wealthy nations. Solutions exist, but they require political will and public consensus. Many experts advocate shifting payment systems away from fee-for-service toward value-based care, where providers are rewarded for keeping patients healthy and avoiding unnecessary hospitalizations. Expanding and strengthening primary care is another crucial step. Investing in preventive care, nutrition counseling, mental health support, early screening can reduce the need for expensive interventions later on. Transparency in pricing can help consumers make informed choices and put pressure on high-cost providers. And policies that allow public programs to negotiate drug prices, cap out-of-pocket spending, or regulate surprise billing can bring relief to patients directly. Still, none of these reforms will happen overnight. The structure of American healthcare has evolved over more than a century, shaped by economic interests, political compromise, and cultural attitudes toward markets and government. Changing it means confronting powerful stakeholders, pharmaceutical companies, hospital systems, insurance firms, and rethinking deeply held assumptions about how healthcare should be delivered and paid for. For individuals, the best defense in the current system remains awareness and preparation. Understanding the details of your insurance plan, seeking preventive care, and asking questions about costs before treatment can all make a difference. Some people use health savings accounts to set aside funds for medical expenses. Others rely on patient assistance programs or hospital financial aid when bills become unmanageable. While these steps can't fix the system, they can help individuals navigate it more safely. Ultimately, the high cost of getting sick in America reflects not just the price of medicine, but the choices society has made. We have built a healthcare system that can perform miracles: transplants, advanced cancer therapies, robotic surgeries, but often struggles to deliver affordable, consistent care for ordinary illnesses. We have accepted a patchwork of public and private coverage that leaves gaps and inequities, where the cost of survival can depend on your job, your state, or your luck. Until those deeper structural issues are addressed, the experience of illness in America will continue to carry not just physical and emotional weight, but a heavy financial one as well. And so, when Americans talk about the fear of getting sick, they are rarely speaking only about the disease itself. They are talking about the bills that follow, the paperwork, the phone calls with insurers, the uncertainty of whether care will be covered, and the quiet worry that one unexpected diagnosis could unravel a lifetime of financial stability. It is a fear that touches every household, regardless of politics or income, a shared anxiety that reveals how deeply intertwined health and money have become in the United States.